In the middle of the widespread COVID test shortages, you're now able to request free at-home tests from the federal government. The new website, covidtest.gov, went live one day earlier than expected, and now every household can request 4 tests a month for free. Christina Laurie breaks down how it works.
I might take it for granted that I can drive to the nearest Walgreens and get a test, or that I can, spend $50 on some N95 masks. There's a lot of people in our communities who can't do that.
Throughout the pandemic, we've seen disparities in access to healthcare and life-saving supplies play out in real time.
By having a program where these things are both easy to get and low to no cost, we start to address some of those disparities.
The new federal website, covidtest.gov, which officially launches Wednesday, went live one day early, giving all Americans, insured or not, the ability to have at-home rapid tests mailed directly to their homes for free. Each household is limited to 4 tests a month, which will ship within 7 to 12 days of ordering through the U.S. Postal Service.
Is 4 enough, or does that number need to be higher?
Families with more than 4 people are still limited to 4 tests a month. The decision, the White House says, promotes broad access. Dr. Pothoff says how often you test really depends on what you're doing.
Making that more accessible for folks actually benefits all of us.
But 4 tests is a good baseline for every family to keep in their medicine cabinet. People with private insurance can get an additional 8 at-home rapid tests covered every month under a new rule that went into effect last weekend.
So it's a win-win all the way around to try our best to eliminate these disparities in healthcare.
In Madison, Christina Laurie, News 3 Now.
Now, when it comes to PCR versus rapid test, Dr. Pothoff says which you choose really depends on how sure you want to be. Rapid tests, he says, are most effective when you're showing symptoms and are less reliable if you are asymptomatic.